Welcome to RetinaRA.org, a Vitreoretinal knowledge sharing platform. This video will present Four-Flanged Technique in the management of a dislocated intraocular lens. The surgeon is Mehmet İçöz. The preoperative visual acuity was 0.05 decimal. The surgeon chose to use the four-flanged technique to fix the subluxated four-haptic IOL to the sclera. He placed 4 marks at the limbus 90 degrees apart, followed by marks at 120 degrees and 60 degrees in the upper and lower halves. He also placed 4 more marks 2 millimeters away from these marks, creating an imaginary straight line extending to the central cornea. After retrieving the four-haptic IOL into the anterior chamber with a spatula, an anterior vitrectomy probe was used to clear the remaining vitreous and cortical tissue behind the lens. He used a 27-gauge insulin needle tip and 6-point row Prolene sutures for scleral fixation. After inserting the anterior chamber maintainer, the insulin needle was first guided into the vitreous cavity from the superior nasal, perpendicular to the sclera. The insulin needle tip was then passed under the first haptic grasp with the anterior chamber forceps. A 6-0 Prolene suture was inserted into the anterior chamber through the superior temporal corneal incision. It was then pushed into the insulin needle tip cannula using forceps inserted through another corneal incision on the opposite side. The needle tip and suture were then withdrawn from the sclera. The same procedure was then repeated for the superior temporal, inferior nasal, and inferior temporal quadrants, respectively. After the IOL was centered, the suture ends were trimmed and flanges were created. After the incision sites were edematized, the IOL was found to be still centered and not tilted. However, the pupil appeared slightly irregular due to surgical maneuvers. In the post-operative evaluation, uncorrected visual acuity was around 0.5 decimal, while best corrected visual acuity was around 0.7.
You can share your interesting and educational cases on our website, RetinaRA.org. Don't forget to click the like button and follow our channel to be informed about our new posts.